Okay, thank you so much everyone for coming back. And now we have with us Sukaina Alzyoud, an associate professor at the Hashemite University. Currently, she's the Dean of Academic Development and International Outreach. She's an active researcher serving as a principal investigator on several projects in the field of community health. Very glad that you joined us today.
Thank you, Ahmed. I might switch off my camera because of the weak internet connection. That might, do some troubles for the connection. So I'll keep it as long as we are fine, but at some point I might need to switch it off. So let me share my screen. Okay. Okay, here we go. So this is just a note. I wasn't able to do a full PowerPoint. I apologize for that. So these are just kind of my thoughts and my thinking about the decolonizing of global health for this conference. I would just give a brief background about the health education or higher education system in Jordan, and then give my observations and my notes and the data that I know about the public health in general and health education, medicine and health sciences education in Jordan. And I would then talk about COVID-19, this pandemic, and what can we do in Jordan beyond that, because there's no normal, there's a new normal, and how all the medical and health science schools need to address this new normal. So basically in Jordan we have, as you can see, we have a number of universities. We have 8 state-supported universities, or what we call here governmental university or public universities, and around less than 20 private universities. All the medical schools currently under the public schools or universities, there is no private medical school currently. There are some approvals and some thoughts. And there's some resistance toward that, because one of the, which is interesting, one of the main opposition for this is kind of the colonization, because the ones who are proposing to open it privately, open the medical school privately, they are in a way moving or having a westernized, totally westernized curricula and way of teaching for the medical sciences. Our higher education, all the students are getting accepted through, we have a national admission system, except if we have what is called the parallel program, where you can approach the university. For the private universities, everyone can apply individually. There is no, but most of the students go for the public universities here in Jordan. 60% of our student body in all the universities are females. And 90%, we have a 90% completion rate. And it's interestingly also among females more than males. All the universities, public and private, are teaching focused. Research is not, we don't have any research focused university. There is some movement in some universities to move toward research. It's individual efforts and mainly driven by the researchers and the faculty members who are in this area. So now I will talk about what's decolonizing in the global health status in Jordanian curriculum, and this goes through all the universities, private and public. Actually, almost all the universities, they adapt curriculum from outside. Some of them, they get, I would say, modified somewhat to accommodate the cultural system. However, all of them adapt a totally Western curriculum, either from the US, totally, entirely, which is actually, it's almost everywhere in all the health and medical schools in Jordan, or a mix between both the European style and the American style, or education system, I would say. So, for example, for my university, the Hashemite University, in the nursing school, it's a total American system structure. For the medical school, it's the unit, which is the credit hours. However, when you look at it, it's the year and how they progress. And they have some aspect of the UK and some of the European medical school aspect. For public health, it's not one of the primary areas and not one of the, I would say, integral parts of the health system in Jordan. There's some efforts. Like, for example, I'm a community nurse. However, there's no practice for community nurse here. The primary level, primary health level in Jordan is very minimum. And even for the health system, the focus and the budget and the allocation of resources is at the minimum, which had been very clear and evident during this pandemic. So when we talk about decolonization, when I was thinking about this and preparing this talk, I thought that there's a concept to me that's very clear is mind colonization, which is basically we're taking all the Western thinking and the structure and the curriculum and put it in a different cultural context. And this is very evident because, as Ahmed said, I used to be the Dean of Academic Development and International Outreach for the Hashemite University. So I had some experience in the exchange programs, the curriculum development for our students. And I had also the privilege of communicating and contacting the other universities. So I worked across all the higher education system in Jordan. For example, currently the well-known and we'll talk about the Erasmus programs funded. There's one of the funding tranches is for higher education capacity building. When you participate as a university in this type of programs, you have to, it's a mandatory that you have to apply the Bologna process in order to get the funding and in order to achieve your project. So basically you are not doing it from your cultural context, however, you are doing it from the European system or process. For the cultural exchange program, that's another funded project for the students to go for a cultural exchange and also for faculty members. So the same when the students need to, or the university in general has to want to participate, they are required to acknowledge and be familiar with the Bologna process and how to convert, because we work in credit hours, like 3 credit hours equals plus, and we have grades, however, they don't have. So your university has to acknowledge that and has to work a process where you accept it when the students come back, and before they go, they have to figure out how the students will come back, these credits will be transferred. This is also a challenge mainly for medicine and health sciences, because once the students decide they want to go, it's very famous, I would say. All the students want to go and participate. And I used to have visits from the health sciences and medical students who want to go and find opportunities to travel and experience this. However, they are one of the main challenges of finding placement for them, because it's very limited with the differences in the curriculum. The other thing is, although we have a credit hour system, but it's mainly a year structure program. So it's a blocks. If you miss the first semester of this third year of your program, you have to wait until the next year to finish to come back and deal with the next cohort. So you're missing out. The other thing is different structure programs between Jordan and between, I would say, Europe. It's easier for them to go to the US, for example, for at least their exchange and their, they call it an elective course. So this is one of the challenges. So in order to be able to send your student for this, you have to change and again, do a different type of program. So there are some challenges and risks. The risk of staying behind, not graduating with your cohort. So you'll be delayed at least 1 year. And this goes across for the medical school, for the nursing school. Even we had one pharmaceutical student who went there, and now he's behind 1 year of his cohort. The language disadvantage, although we teach in English, everything is in English. particularly for the science and health. All the health sciences are the science. However, they are still at a disadvantage. Some of the courses are not taught in English. Some of them, they know English, they can read English, they study in English, but most of the courses in our university are taught in mix. So we teach in Arabic and English at the same time. So we have the language disadvantage. I wrote financial luxury and then I crossed it out because although it's funded, for example, the EU, they support the students for the ticket and for monthly stipend, and they help them out with some housing. However, all the rest is at the student expense. So if there's a visa requirement, sometimes it's not in Jordan, they have to travel to another country, traveling even locally. So all that expenses has to be on the students. So the majority of our students, they are not at an advantage with the financial luxury. So also this is another challenge to miss out in these opportunities. The visa issues and all the challenges that comes with the cultural exchange. If we talk about the US, it's a totally different story. The students have to pay for everything. So that's another big challenge for them to go. So at some point, I remember 6 months ago, I was in a meeting and it's labeled as the elite elective program because students who have money, they can, travel and have some experience. However, students who are not financially advantaged, so they will not be able to participate. They can do this, I would say, nationally in different universities. However, and this is, to me, it's a very clear cultural, I don't want to say disadvantage. However, it's not recognized as a good opportunity and learning opportunity, the same as if they traveled abroad. So in general, this is the academic situation. It's mainly all of our curriculums, programs are based on Western, either European or American systems. Even if you switch, we always go and look for their curriculum, their programs, and adapt their experience. Sometimes we adapt, sometimes we change, modify, but this is not all the schools, unfortunately. For the research, because I'm academic and research, as Ahmed said, in addition to my work in academia and administration, I have a strong background in research. And again, through my work for the International Outreach Program, I was responsible for linking our faculty members and researchers with researchers locally, regionally, and internationally. And from my own experience, actually, in doing research, after I graduated from the US, I was taught in the US, and when I came back, I have the mentality and what the points I'm talking about. I was educated there, so I transferred the knowledge I got there coming back. The methodology, the ideology, the school of thought, mainly I came back with. So I applied here, and I tried to apply it here. Sometimes you forget and you have disconnection as an academic a member and as a researcher. Was I don't want to say you are disconnected with your own community. However, this happens because you are in your bubble and you are educated somewhere else, and coming back with all of these great ideas and coming back to apply them, because you spend all your education life exposed to a different learning thinking and learning context. So then you come back and now you start your career and you have to apply something different from what is actually there. So most of the researchers and most of the faculty members in almost all universities, the majority are taught in countries, in the US, in Europe, and this is actually preferable. Even when we announce for scholarships, for students to go and get their degrees and come back work for the university, we put one of the conditions that they get accepted in one of the universities abroad, either the US or in European countries or some of the Asian countries. So once we come back, we have the practice, the thinking, we follow the, I would say, colonial countries, the school of thought, how we were educated. So this is what I'm talking about, science mind colonization. It's not physical colonization. Basically, your mind is not working in the same culture and environment that you are living in and trying to work in. So from research methodology design, I know research is research everywhere. However, there are some different methodologies that work out in some areas and does not work out in other areas. Mentorship, partnerships, and collaborators for sound studies and projects are most of the time from colonial countries or Western countries. If you want to be a successful researcher, a well-known international researcher, you have to collaborate with researchers from abroad. You have to have some name, and you have from, in my example, I would say the US most of the time. And this leads me to the funding issue. Funding and donors. Most of the major funding, as colleagues previously indicated, comes from the Western or the Northern Hemisphere of the world. So if you want to be a good researcher, you have to work and you have to have the skills and the knowledge and the experience to be able to get this funding and to approach these donors. In order to do that, you have to work with an experienced researcher. And most of the experienced researchers come from that part of the world. And this is, I can mention examples of our colleagues in Jordan or Jordanian researchers who are well known internationally. But when you look at their CVs, when you look at their background with their projects, you would see it's almost always there's international, Western, Northern part of the world, researchers and funders and donors. The other part of research is publications and result dissemination. Most of the recognized and accepted journals here for researchers, for faculty members to be accounted for their promotion, they are mostly and mainly Western. So if you want to your work to be accepted, again, this leads you again to be an internationally known researcher. You have to publish in high impact journals. You have to have the skills, which educated in English does not mean and does not equal high quality writing is suitable for research for respectable journals. At the beginning of my career 10 years ago, I struggled almost for 2.5 years to have a paper accepted in 2-point-something journal. And I resisted so much, and this is a personal example, but then I had to collaborate with researchers who are well known in the area I was researching and in my line of research. It's an advantage. I'm not saying it's a bad thing. It's an advantage because you acquire, but it's, as another colleague said, it should be a collaborative effort. It should not be because of they are from there, their work is more recognizable and more significant. But this is the reality that we live in. Most of our colleagues, they struggle with their publication and publication record because of the English. Until now, and I work with Ahmed and other students, until now, we need to send our work for English editing. We need to send our work for review by like one of the well-recognized researchers. Absence of research publication mentorship for junior researchers. And the concept of teamwork and research teams is not well familiarized. It's not well accepted. I will not say accepted. I would say it's not well recognized, and the benefits of it is not known. However, when you ask colleagues individually, you see they are still connected with the research team at the university that they graduated in, whether in Europe or the US. So this leads me to the regional local conferences. They are looked down upon. Some of the time, even our university do not fund us if we apply for funding to attend or to participate in local or regional conference. And they would say, oh, it's not scientifically sound, it's not strong enough, it's not international enough, and all of that. So it's more difficult for us to travel, to go to the Western, more developed countries. So gaps that I noticed in research and in academia, educated and trained in Western countries, meaning we will train and educate with the same mentality and the same thinking. All books and training materials are coming from that side of the world. So when we train, or even when we develop training programs, and this happens at the lower level, we try to find something that's already developed or procedure manual or whatever, and we use it. It's almost the native local alternatives for teaching material, education material, research materials. It's very limited, and even when it's available, it's not recognized as credible as that's come from other parts of the world. So now we are at this pandemic that's making us all, I think, the same. If you are in the US, if you're in Canada, if you're in Zimbabwe or in Jordan, we are all the same. We share all the same experience with differences, but I think it's all over the world. We are. It almost seems that we are living in the same village or in the same place. So this is also exposed some positive points, some silver linings, and some weaknesses and disadvantages for Jordan. At academia and medicine and teaching education, most of the time we look at the West and more developed and how they are doing, how they are handling it, and then we follow them. Some delay sometimes happens because of we are waiting, kind of. We took some steps, I am not ignore that, where we took some great steps in addressing this and trying to handle it and trying to not lose enough. However, the health sciences and the medicine has suffered the most of all the different academic programs here in Jordan, because in clinical training, you cannot do virtually. So for example, for our nursing students, all the clinical was converted into theoretical, and all the exams or all the tests were converted into a multiple choice. So this will not, it will deprive them of the opportunity to have the training. And for example, and I think the students will know more about this, the medical students we have today, at some point they decided that all the medical and medicine students and the dentistry, they will go back to actual testing and the actual training. And then because of the situation, I think they changed it now. They have to go for online testing and online. So this is a disadvantage for this area of academic program. For challenge, which I think it's an opportunity, practices of public health prevention. I said earlier, primary health is not one of the major health, I would say, infrastructure health programs in our health system in general. However, this was a great opportunity. We saw the rapid development of the tracing and the tracking program in Jordan. We saw a rapid development of teams that were responsible for finding the cases, tracing them, tracking them. So this is, to me, I think this is one of the great things that we benefited. But however, we still have work to do. We adapted systems from different countries. Some of them, I think one of the most successful examples came from Asia, as was mentioned. And in Africa, one of the countries was successful in controlling that. So in a way, the colonies somehow have successful stories to provide for the the other part of the world, or let's say the Western countries. Research mostly descriptive. We have, since the pandemic has started, I started seeing more research. To me, this is a positive from a researcher in Jordan related to the pandemic. However, my only take on it is mostly descriptive and small scale. But this is a great step. I mean, this is a great step and opportunity to build on for the future. The dissemination almost ceased. This was unfortunate. I was participating and organizing several conferences locally, but it's almost ceased because we were not able to convert to the virtual because of the infrastructure and the capacity building of people that were responsible for it. So we were not fortunate enough to be able to hold these conferences. The data, so health data in Jordan is kind of difficult to access. And this is one of the disadvantages that were exposed in this pandemic. So in order to, and I was one of the researchers who tried to, and I emailed everyone, I tried to contact everyone, however high up I was able to go, to have access to data, to do some analysis and research beyond the number of the, like the prevalences, the number of how many cases, deaths, and all of that. So the detailed data is not easily accessible. However, when I shifted my focus from Jordan to globally, I was able to download data. I was able to find, and this is one of the, to me, weaknesses, or I would say areas that we need to look at, that we need to collaborate on making data accessible and available. So the positive silver lining again, lots of research was conducted remotely. Researchers were able to adapt fast and in I would say, efficient way to conduct some research. So what's beyond or post COVID-19 for public health in Jordan? I think we need to build on what we already achieved now. We need to think more about the primary health care, which is not one of the major branches of our health system. We need to recognize and establish research within the Jordanian context. It's not always adapt even tools from somewhere else, and it will not apply to Jordan. It will not apply to the way of thinking and the Jordanian context. And this is the end of my talk. So I hope we're fine. So I keep the camera.
Thank you so much,
Am I good?
Dr. I honestly enjoyed the really life examples that you shared and how you use your experience as a mirror to reflect the different concepts discussed today. And you presented real life scenarios that you deal with, and I'm pretty sure other people are in the same boat and they can relate to what you are describing and discussing. So thank you so much for sharing.
Welcome.
Now we move on to the International Federation of Medical Students Association's Jordan Students Group. They are a group of bachelor medical students from 6 different universities across Jordan. They represent the voice of more than 4,000 medical students in their country. The students work on public health projects, medical education, human rights, research, and professional exchanges. The floor is yours.
Okay, Ahmed. Thank you so much for the warm welcoming. Well, let me start this. Greetings, everyone. My name is Hussam Tarauna, and I'm a medical student at Hashemite University. In our presentation today, me and my colleagues, Mr. Ala from the Hashemite University and Mrs. Yasmin from the University of Jordan, will be sharing with you the medical students' perspective and how us medical students are struggling with colonization. Well, first of all, let me share with you a brief introduction about the International Federation of Medical Students Associations. We are a national member organization that follows an international organization called IFMSA. We started in 2006 and currently actually representing over 6,000 medical students all over the kingdom. IFMSA-Jo field of work is based on six different standing committees, and they are concerned with matters related to public health, reproductive health, human rights and peace, medical education, and we have our own international research and professional exchange programs. Actually, in IFMSA-Jo, we conduct projects, campaigns, medical conferences, and workshops that are related to our scope of work. And we had conducted over 500 projects so far. So, which is, by the way, led by medical students to serve the community we live in. Our projects are also often recognized and awarded internationally and regionally for the impact it achieves. I would like to point out that we are also recognized and by our government as a registered NGO that works with the Ministry of Health. And we have strong ties with other governmental organizations, NGOs, and international health organizations. Now that you are familiar with us, allow me to introduce our discussion for today on how colonization affects us specifically and all medical students located in a low to middle income in general. I will leave the floor to my colleague Ala to talk about our global and public health activity barriers.
Hey all, I hope that you can hear me now. Yes, thank you. Hey all, I am Ala Mohammed Rawashti and I'm a medical student from the Hashemite University and I'm the current National Public Health Officer in IFMSA-Jordan. Regarding this topic, I just want to say that it's unfortunate to see that often our priorities are not in the same line with the priorities of those who are supposed to support us. Many organizations in Jordan are willing to dedicate their efforts toward issues that are not pressing nature for our country. And when we approach them to ask for the topics which are considered priorities in our country and region, we usually don't find any support. From our experience, I can take antimicrobial resistance as example. Maybe antimicrobial resistance is one of the most important topics in Jordan, and in IFMSA-Jo, it's one of our priorities in public health. So we have a comprehensive plan to raise awareness about public health, about AMR in Jordan. Unfortunately, we cannot find support to work on sufficiently on our plan because our side of the story is not on their agenda. So in the last 5 years, IFMSA-Jo haven't found any support for this very, very important topic from all of the national and international organizations, except for the WHO Jordan office, which supported us with some awareness brochures template only. Even the WHO Jordan office, our only partner in this very important topic, has not supported us financially. And as you know, as a youth organization, we depend mainly on sponsor support in our activities. So now we can see that all of those organizations support what they want, not what the countries really want. So my point here, what's most important and necessary to support our real country's priorities or those organizations' agenda? Another example I can say now is that IFMSA-Jo conducts an annual public health congress to discuss public health topics with the stakeholders and decision makers in Jordan, to teach our members about advocacy and to involve them in decision-making process. And as you know, that this type of conferences need sponsors and partners because we as a youth organization cannot afford the high cost for conducting such conference alone. Last year, I was the head of the organizing committee for this Congress, and I contacted most of the international organizations in Jordan to support us, but all of them refused because this type of activities is not on their agenda. Even that we had the Minister of Health as the patron for our Congress, but they didn't find our activity worth their support. So by this, we can know that meaningful youth participation is not even in their agenda. I would like to close by saying this is unfortunately, this is not our struggle alone. And I saw that during my participation in the pre-World Health Assembly workshops by the International Federation of Medical Association. In many workshops, I heard the same stories from other participants from other countries. So this problem is not just ours. It's just a global. It's a global problem, and we need to change for a better. We need to change it for a better future for us. And that's it now. I will leave the screen for my friend Yasmin Shibli. Thank you.
Oh, thank you so much, Ala. I'm not sure, is my voice clear?
Yes.
Can you hear me? Okay. So I'll be discussing what decolonization creates as barriers to us as medical students during our education. Ala, if you can move to the next slide, please. Yes. Their ambition is high and opportunity is scarce. As victims of brain drain, Jordanian students like myself ultimately seek to continue their higher education as somewhere in the shiny West. Not all of us make this choice willingly because we don't think our home is good enough, but simply because there isn't enough to go around and there are still subspecialties and skill that are not available for us to learn in the comfort of our home country. The number of medical students graduating from Jordanian medical schools is increasing every year, yet residency spots are still limited, with a vast majority of those spots being unpaid training spots. With that in mind, it's time to highlight what it takes for us to carry on with our education. Most medical students will choose the traditional route of pursuing a residency after receiving their MD, while others continue their master's or PhD in the various health sciences. Both roads are rocky. All graduating MDs become interns for a whole year, during which they will study for various exams they choose to take, ranging from language tests to board exams, all in the hope of scoring a residency. This process is lengthy and an expensive one, limiting it to those who have the accessibility, limited to those who have the financial merit, and preventing those who deserve it from gaining it. The choice to continue abroad also comes at a cost that is more than just monetary. International medical graduates, especially those from low to middle income countries, are at a disadvantage when choosing what they want to specialize in. Years of hard work and experience up one sleeve. Competitive majors are still often unattainable. Next slide, please. Okay. Externships. Now, we all know that exchanges and electives are a vital part of any medical student's education. They are not only academically valuable experiences, but they are wholesome experiences that enrich one's personality. As an organization with an active exchange program, IFMSA-Jordan has taught us how easy it is for us to host students in comparison with sending them abroad. We host an average of 150 exchange students every year, most of which are of European origin. Those students are blessed enough for the process to be hassle-free, with no worries of visa rejection or collection of countless random documents. On the other hand, our students seeking similar opportunities abroad are in constant fear of rejection, especially after investing sums of money into the process. You're all familiar with how often visas get rejected, especially for students from countries like ours. The experience sought is also different. While we travel abroad, eager to learn from their mentors, most of our incoming students come here, and I quote, because they've never been to the Middle East and want to explore Jordan. Next slide, please. Okay. Lastly, research and publications. It was previously mentioned by other speakers how research is a difficulty for us global South countries. And that's because the Global South was always the subject under the microscope and hardly ever the scientist looking through the magnifying glass. Research in our countries is far from where we hope it would be. And as students here, those of us who discover the world of research are often disappointed with our limited chances to participate. Our huge numbers make it difficult to find a mentor and support for our projects. Grants for studies are scarce, limiting our studies to cross-sectional models more often, and our publications hardly make it to magazines with an impressionable impact factor. Many students will try to enrich their skills by doing research internships abroad, but even then, a lot have to make the sacrifice to work without being rewarded or without even a promise of getting paid or published, while other students will get both paid and published for the same work provided. In conclusion, us Global South students shed blood, sweat, and tears in our journey, but it doesn't have to be like this. With decolonization, we can pave a smooth road for those who come after.
Thank you so much, Yasmin and Ala, for sharing our perspective. Now that you are familiar by what this means to us, allow me actually to explain how we plan to take action. Well, simply by two steps. Step one is for us to start the dialogue to spread the word and familiarize the students with the concept of decolonization. And step two would be, as soon as we have a sufficient and background on this concept, we will start actively trying to solve this problem by working in projects, drafting policy statements and documents, and starting the dialogue with our international family within IFMSA. We thank you all. We thank you all for allowing us to be part of this conference. And as maybe one of the previous speakers mentioned, we are not taught about the concept of decolonization, but once we are exposed to it, it resonates with us. Thank you so much for listening. And if you ever wanted to know more about us or help us spreading this message, feel free to contact us. Thank you.
Thank you so much.